Lakut, everyone. It is Wednesday, April 21st, I think. Yep. Just quick updates today. Lots of opportunities for questions, I think. Premier will speak, and then Dr. Patterson, and then we can get right into it. Thanks.
Nasa kutlumi pingat si April 21. Apek sa una lang ayo siya misakti. Sibulat dia kali malaw ni Dr. Patterson.
Ublaat siya nung mute, ublumi takwa nuban na kayo ataw helmi ilagyato kihani ataw helmi taw nuban na kayo akaun niya to nunubu iluani. Mahanaw yo takwa 33 nguyut nuban na kayo akakto nunubu iluani 31 tabban niya kalung ni amama ko kingay ni. Ublumi tikid lugo takwa nuban na kayo ataray kutimi kapiyaw himayut 14,559 Tan hiwala pa mi kapiyaw himayut. Amadakwa tuglia ni kapiyaw himayut nuban na yata kay kuti Moderna mi 11,605. Man natako himalagap ta tana nuban na ya nunilip ni Avenlini 6 and kawi suta kano tana ayok na ngitiging mga tana nuban na ya anya na ay tuloy ni inum Ana pidju tigit lu ta ko ne vu mi titiliok to na pakka ya kai tige ma lu ta kapiyo himangin na ko no ban na yo ta ga ko timi kapiyo na ko tit an ya ring mun o ka dug dutit kapiyo ya to luti amata ko hibul la pa mi kapiyo himan na ko kingul le ni tug le ni kapiyo ya to ma ko tit ko ma ko le ti kapiyo himan la ko 94% mi pigu na ka na matan no ban na yo ta ga ko tit timing ni Kwa kabna nunani tuli kapiyo waktu alut takin ami hunu utakin batahuli takwa nuvan na ya tare kutumi kapiyo waktu kihani utak kayut innai taman inna tokat seme kihani kapiyo tamatahuli uvagul litana anya nuvan na ya tare kuti amigangi mantabane nunubu ilwani takwa Canada kama kotingit mat na kema mapagkatakwa amigang ito ninamak to nakiu tilaw matatakwa inuin nunanganut mat na pagka kapiyaw himanginaw kapiyaw yak to kumaputit amatakwa akay tiga kanawa so ginunabu miu takwa anya tailitichi ko maliktaw kaya malilaw labut ublalungin luta aggawoy megayug lugit kinap pag mato am atol luta anigaramta Niuwa wilyara ta kunun takawot nakhangin luwit ama kating ngaluang iluta kapiyaw yutit nunebu miut hawi mayonala chana mata uwap tinit nagligiyap tinit ilap tinit menere cha law ila menere cha law lavut ta nuwan na yo haligi na mayabut mat now you him. Good morning. Today we are reporting one new case and one recovery of COVID-19 in Nunavut. There are remaining 33 active cases in the territory, 31 in Iqaluit and 2 in Kingay. To date, 14,559 Nunavut have received their first dose of the Moderna vaccine, and 11,605 Nunavut are now fully vaccinated. We've seen COVID in 6 of our communities now, and we see how easily the virus can be transmitted. I'm once again asking any eligible adult Nunavut, please get the Moderna vaccine. If you haven't booked an appointment, call your local health center to set one up. Our neighbors in the south are waiting weeks and months for their chance to be vaccinated. Nunavut has the vaccines. They are here and available. It is now up to you to do your part and help protect our communities. As always, I'll end with this. Stay safe, mask up, wash your hands, keep at least 6 feet distance from others when you're outside, stay home as much as possible, and get vaccinated. Take care and stay safe, and I thank all Nunavut for their patience and understanding during these trying hard times. Thank you.
Good morning. Today we have confirmed one more infection in Iqaluit and one recovery. Contact tracing continues around the cases in both the city of Iqaluit and Kingite. High-risk contacts remain in isolation. I urge people not to panic or spread rumors. We will announce cases as they are confirmed, and there is no need to speculate on where COVID-19 is. Rumors only do unnecessary harm to people's mental health and the efforts to control the spread of COVID-19. There continues to be a lot of questions about testing. If you have concerns about exposure or symptoms, please call the hotline for advice. For clarity on symptoms, they include sore throat, runny nose, new or worsening cough, shortness of breath, loss of appetite, muscle ache, loss of taste and smell, tiredness, fever, or upset stomach.
Ulla sakut uluminalo na sibugut ataw sikkanang miknuwadyo 19 tas mayumik iqalunni amalo ataw sikhanoy gunnego to hasimayumik. Katiyaw si mayuni khawi sakpalyang inaktu tamakkunuwa tabani iqalunni amalo kingarni tay ko uluga naktamin nakse katiyaw si mayumini tay ko ani tele khuyaw si malaktu ta ko ayaw to kakikutu nain to avil ila khwasalo asma hunagir amalo sulingit tuni khawsa khatta hunagin naluna sa khatam na to naluna to yo haray panuwadyo naktulinnig tay mais isimatuin nam ne khatta hangito tinami mga no wadyo am tamakko sulingit tut an ko to tuin na khattanga takikutu na isumanginut at suruti yatinullu awlat siga so ang mesya mapalle tay le khullu no wadyo 19 tay mga persok to kay nang asuli hawi sakta khatta ko nak mga ta Isumalo to Harovi, Katia have 2 minutes or you will Ballohano go to Harovi, Taitsumanga, Halagun, Nakto, Halavu, how Jogayak to Tisuga Harayamangape. To Kisinatia, Lugohano go to Nato, Ukoa, Eya Lutik, Kakili Naluting, Husulite Nalutik, Balohu, Sok Palali to Naluting, Ipina Hataluting, Neriguma Luting, looking in Akamilio Luting. Mama sarun nerluni amalunay gunay liluni. Takasimay narluni, utang narluni, balunanguluni.
Vaccines continue to be offered in all communities. Call the health center in your community or Iqaluit Public Health to make an appointment. If you are on isolation because of circumstances around the current outbreaks and are worried about missing your opportunity, please don't worry, there will be vaccines available. As soon as you are off isolation, call and make an appointment. Yesterday, Aviat's outbreak was officially over, and I congratulate the community on getting to this point. If in the upcoming days there are no changes to the current risk in Aviat, we will be in a position to ease the restrictions there on April 26th.
Suli kapiyo gutu yut atu ino yunu nalilimani. Ana bitsino khala lusi balo khalunne humayne na be mo init sale lusi ani teli titaw go bitay mag solo man no yasa mapalle ani pijuti gilu balo ismalu ta khago bi kapiya gunna lang ngamut ismalu gi atong ituti tamakwa kaputi sulatu inawla ngata tay mani teli gunni to ago be do khala gunna tuti init sale lutin ipatsak avverni sa mapalle ani naluna tawla kut ani go tismalu ninganik Pikku bakka vermion tamanna tiki utiguna ratio. Ulugalaw na ato na si Jack to hangi pamano yo kuluga na tumigun ne patas av vermion. Tayo manalo na sigum na lato gutamako sulit tak utaw simayo no kapitaw na ningin April 26 mulakan.
Next Monday, Aviat's restrictions will align with the rest of the Kivalliq. That will mean all businesses can open, schools can open, outdoor gatherings will be restricted to 100 people. Indoor gatherings, household gatherings will be restricted to household plus 15 visitors. Individuals must continue to maintain a distance of 2 meters from others in public, other than members of their immediate household. Gatherings in spaces such as community halls and conference spaces will be restricted to 100 people or 75% of rated capacity. Recreation facilities can open with group sessions limited to 25, and masks are strongly recommended.
Nagkatsaw lahat umiyak vea mi isulit tabiw titaw malit taw giali tay matsain na ulilahat to kivalam mi ulimatitun. Uko ay matukiling. Namin na hati yuli mama to yung nalasi yun. Ilin na abi mato yung nalasi yun. Sila mi katikataw na to isulit tabi halaluti 100 ngugun naluting. Illu ane illu mi hatigi ni tako illu mi hatigi amalo 15 hakan ni ngagupulak to haron naluting. Kikutuin na suli ungasigit ila kanigilo atele hattaraili 2 meters asingin kikkutuin namne inne atuarotik illu me hatigi ngitamini illu ilo ani katikhattarun nartun isulit tabbeham nartu 15 no tako katikhattarun nartu nunalinni surlo pingwa binni katima binni isulit tabbehale alto 100 ngugun narlutik ubalo 75% ngita ino harun narningita pingwa bin Matuirun na lahat 25 ngugun na luti katigun na to. Kasi ani suli matuwag sumay na katakwi yugalo at aman na atuli ko yitsuti tuwid na ulak to ni.
I also want to point to Aviat and other communities where outbreaks have occurred to demonstrate that following the public health measures works. If we continue with the model of partnership between public health's work to track, trace, and isolate the virus, and the public cooperating with the public health measures, we will get through this. Thank you.
Lalo na sigo magibunga tayo kwa avveani amalo asingin ni nunalin ni sa maksima viola ni lalo na sigo na siya lang at tayo mamalit siya katana na hamnang ituloy na mamalit tao galin ni ato tikaron na siya nga tayo mata ko edyo at siya tigo mali na logi katod siya katigi lutaan na hamnang ituloy ko tamak ko piliritin logi katiyaw yung minang nakawi sa katam na mot amalo Nunavut to hangi kalo mga takawi sa katam ng mot anitailit itsinang molo tako kutuin na ikayo katigit sa luti tamak ko sulit tabiw titaw yung tayo mailo na tani gud sa katigigod naktigon ayan mami.
Jackie McKay, CBC News. Can you remind us what requirements need to be met to be a recovered case?
Jackie McKay, CBC, kung ne kaitigo nakitigo hatsi mga tatako kanoy kung ne utakak simayo.
For most people, it's 10 days from the onset of symptoms, or in case of asymptomatic people, when they get the positive, when the swab was collected. And they have to be symptom-free for at least 24 hours for when they're declared recovered or resolved.
Recovered or what?
Resolved.
Ami suna sa tako ng ulo na huli ni kanoy kung ne kutakakatak to tayo mga kanoy kutakala gialaw nga pigyak tigo o balotay ko nga kanoy kutakangit to Nunavut anak to ni galawano kaway sa ko timi nga nalo na tawlaw tilo kutako ulo huli kanoy kung ne nakaktaw katak to amalo ikakani 24 hour ni kanoy kung ne sa malak tilo tayo mga kanoy kung ne nakaktaw katak to Nunavut anak to haon ne nakaktaw luti.
The Nunavut Quest is scheduled to still go ahead with some changes. What is your recommendation on if it should go ahead or not?
Teko Nunavut me hemot sirjoam na tu suli panna si mamata kayo sila ni nasi just magalo apti kanole taman natuli ko yitutili ko tigigayak kayo.
So we're recommending strongly against all non-essential travel between communities right now, and that includes events like the Nunavut Quest.
Tay may mila atole ko yata sangi yo mi tamak ko pimma yung ito ne pidyo te harlo te awla katta ko yata nunalinno tay mate na ta ko Nunavut me himut sirjoam na tu asingin ni nunalinne nga to hakaya nga tay may ko yung ito gumana.
If, despite those recommendations, they choose to go ahead, or anyone chooses to go ahead with any gathering or any travel, there are the public health measures in place to limit the size, and masks are mandatory. Thanks.
Tay matule ko yung simagalo tilo ta nalat to hamning ipata ko suli malitaw ga hayap to ana hamning itule ka nang mamalitaw ga lit so lokat sigun namning isulit ta be khara hallo ti amalo matoarsimai naqaaqaqayartuti.
Emma Tranter, the Canadian Press. Can you give us an update on contact numbers in Iqaluit and Kingai?
Emma Tranter, Canadian Press kunni uqautigaarunnaqqitigu qatsiulер mga takatiyaussimaju iqalunni kingaarnilu.
Sorry, in Kingite, I'm not aware of the most recent numbers. And Iqaluit continues to be about 66, sorry, last I heard was still 66 high-risk contacts. I don't think there's been any new high-risk contacts identified. There have been a number of lower-risk contacts identified in the last 24 hours, but there's also been a few cleared. So.
Kingaarni qatsiu mga takatiyawimini tusalaungita qiqauyamangitanga nutangunaqpa. Kisani qalunni sulitaqua 66 ngunaqartauyu katiyawimini uluqaanartumiinnersait. Takualo asingit uluqaanartumiinnersait katiyawsimayugalua 24 nikaqani nalunaartausimayu qanuigunner ila ismaalugaaqarnginneqartausimayu.
Can you walk us through the process for when someone is established as a contact? What happens?
Nalunareaqu qanu taakua katiyawimini uneqartaugai mataqaqaqayiqqartauluti qanu atuaqattaqqisi.
Do you mean how they're identified as a contact, or what we do once they're identified as a contact?
What you do?
Okay.
Go ahead.
Okay. So once somebody's identified as a contact or a higher risk contact, public health staff will contact them either over the phone or in person, depending upon the circumstances. Talk about when they might have been exposed. Teach them about the requirements for isolation, staying out of public, not getting on airplanes, avoiding contact with anyone they live with. Teach them about the signs and symptoms of COVID-19, and then make a decision about whether or not to swab them based on their symptoms or the timing of their exposure. And then they'll get periodic follow-ups over the phone to see how they're doing and ensure that they are able to stay at home.
Nalunaartauju 10 minuutillugu katiyauju 10 minuutillugu uluqaanartumiinneqartautillugi taakkuanna mangittulernermu iqqanaajartiu qaalautikkuut ubaluni upagutilluti qaujikkaigаарtoqattartuut adigiin ilaqanutuinna taima nalunaartaulutik kaima katiyaqartuminiuneqartaulutik ilinnaartitausittaqqu qannu maligiahammaga anittailititauningani suurlu angeqqarsimainarluni aulariaqangilluni qangatayuukkuut kikkutuinarni katisigiaqanginninginnik qanu igutti qanuigajarmanga uqaujortautsaarluni nalunaartausittaqqu qauyisartauniarmanga surlungatigut qangakkuunarmanga katijamininga nalun ila malittugu uqaalaviuqattassittaqqui taakkua angeqqarsimatsiaqaluarmanga tamalitsaaqaluarmanga talunni.
Dustin Patterson, Tech News. Are you able to say if the recovery was the individual that was identified last Wednesday?
Dustin Patterson, Tech News.
No.
Aga.
What do recoveries tell your team in terms of establishing a timeline?
They're part of the information on finding out when COVID-19 arrived in Iqaluit or when it was introduced, and that helps us get closer to figuring out the most likely way that it was introduced.
Tamanilagi yaw katayo tukusiyarutiu nuatautillugi qauyigasuartilluta qanu nuvadjuanak 19 iqalunnu tikinnermanga qanillivaallirutiunersaugunnartu qanu tamanna tikinnermanga tamaunga.
Trevor Wright, Nunavut News. What are you guys doing differently with the with the upcoming reopening of RVX, given the second outbreak and how it was reintroduced?
Travel right Nunavut news kun ne hano kadjung itu ne kamane ale kitau vanak vene ta ko akaso yo vanle ane ale tilugit solo tikik kan ne kunago.
We're putting them on the same measures as for the other communities in the Iqaluit region, with the exception of Rankin Inlet. We do have the difference between when the infection or when the outbreak in Nunavut first started is that we have point of care testing in the community, and staff in the community and the hamlet staff have gone to great pains to get everybody or as many adults as possible vaccinated.
Ta ko adi sa ina ina lo ta lo nga na hanang ito le na mamalit taw ga le tay ma chay na kiballer me agato akang yasinor me tay ma adje wi juti gi na tangi tay chumane sibul la pa me sa ma palla le la nga veane tay kani khawi sa ko tit khalaq to khila me yu ko khawi guti gu na tunik amalo khana yak tingin pilo to milo ha malakut nalo na simat siya ka swala nga ta me so na pa nga sa to kapiyaw si makulog ame so na say kapiyaw si malang.
Have other areas of exposure been ruled out at this point outside of the storehouse, or is it still a possibility that it may have been exposed to other places?
Asing ini pataw si mayo hamning ikalo ang mga selo ay merbiase ano nalo na si mabita ko upat si man ikalo ang mga tasingin.
It's still a possibility, and if we find others or if we identify others, we'll announce them at that time. Sorry.
Tayo may gunak daw galo kasi nalo na tayo ham nalo na ila how sa ritsaw tigi kayak tabo.
Jackie McKay, CBC News. Can you confirm if any staff at Iqaluit were contacts with COVID-19 and if any inmates have been moved to BCC for distancing?
Makigakvik?
Yeah.
Jackie McKay, CBC kunni nalo na siguro na kaya kanayak tingi makigakvik me tayo kanitigo yaw sumavim kati ya has mayumi ni yung ikalo ang mga ata malo tigo yaw si mayuni BCC mo ikayok tao bim mo nga no tsak tao sa yung kakasimawa.
Those are questions that would be better directed to the Department of Justice.
Ta ko apirit nga ako bigi maligalari ko na tao naksa.
Right now, you said there's enough vaccine doses for all adults who want to get one. Are we at our max vaccine capacity, or is there still promises from the federal government to receive more doses?
Mana yo amiga singit tu meni una kau abi kapiya ugutit sa yuni tako tiki utis malak habu niri ugilau tabu balo government hakuni suli pitita una andra tau sumabe.
The commitment for the second quarter of this year, so April, May, and June, would be was enough for the rotational workers and to get our population of adults up to 85%. We do have vaccines ready to go for that, so no one should be worried about running out of vaccine. And we do anticipate further shipments in this quarter to meet those targets that they've committed to, but I don't know when they're coming.
Inte ko tunisikan ng nasima ila awlak tikitisikan ng nasima yo tulle ani tat kuno nga April, May, June mo na matunik ta ko kasi ani na malaw nga ta siguro pa me nunalino katatilugi kana yakti 85% tingi ta ko kaputi tikisimalilaw nga ta tuin na sa to gumana yusuli kaputi ni ismalo to hara hangito nungular ningini tikibiu kanila migata kasi na kaya mangito hangal lata.
Emma Tranter, the Canadian Press. Yesterday, with the cases announced in Iqaluit, you said you thought there was more of a risk of transmission at this point. Today we saw one new case. What do you make of those numbers?
Ema trying to Canadian press kunni pat sa khalaw ka viking ngam ni ta ko sa maksituin nak tuminu gya hamning innik ataw sikanang milele lekha mate khano taman na ismagivio.
Doesn't change anything. So, especially when we're dealing with small numbers and smaller communities like this, there's going to be ups and downs from day to day where, for a variety of reasons, one day we might have none or only one case, and the next day we might have several more. It's not really useful to look at it that closely and try and predict a change in the trend every 24 hours.
Kasi just mangito tayo mangawlaw nga ni tako ilagay hatta lang ayut ubalo ilagay ngit sa makiluti ulo tama adyo hatta jangin mata solo pita kangit sa makiluni ilayo kangit sa makiluni ubalo taw sa kaluni tako ilani ko amisu tuin na ron naktuti ulo ilangin ni ilayaw yun kisa ni tayo mga tuta kangin mat kano katsiyo kayang ningin ni sumagaswa kaya tamak ko nga katsiyo kayang ningin ni.
What's the turnaround time for testing in Kingay?
Kano tigitay ko how is ako tiyo yung ngam ning akto utirum na ila how yaw gun naksakatakhan.
Swabs will be collected on during the day. Charter will be running most if not all days to bring the swabs back to or bring the swabs to Iqaluit, and they'll be tested usually within hours of arriving. So typically for outbreaks in all communities, we've been able to get most results back within 24 to 36 hours, and we'll continue to meet that for Kingite.
All days or every day. Takwa how you sagat sa yun wataw gay mataulog ko tay maunno gay macharog ko awlak titaw sa kataktu ulo taman tay may kaluno tikit tuminiw tilugi kakagala kasay nalaw tilugi how you gun nak sa kataktu tay ma sama pala to sama pala yo khalilaw sa mamanita ko tikun nakatak sa mayo ikakay 24 balo 36 tungani tay machay nakingam na tay may liyo jinari bugo.
Does some executives able to say how many tests have been conducted in Kingay and Iqaluit?
Kingam ni tana dasan petar kachiu la kachiu simalaka how you saktaw simayo.
So far in Iqaluit 235, for Kingite not yet. We don't have the number at this point.
Ulo mo Iqaluit ni 235 kingam ni kachiu mga takaw yung mangitabo. Nagadjami sitamang milota ko how you got the hataw na to kachiu ni.
So the 0 new cases in Kingay, is that because of no negative tests or no results yet?
Kingam na how yung mangilati how you saktaw lang yung mata upalo kano.
There were some swabs flown out yesterday, but we update the total number that are done periodically.
Ipat sa how you sa ko tinitikit to kalaw to galaw kasi ni tako kachiu mga ta ilan nila usung kasi na how you got hataw.
Joe Nunavut News. When did the recovery make contract COVID?
Trevor Wright, Nunavut News ko ni tayo nakanoy ko na nakataw yung ano ba dyan nakataw ng.
So working backward from yesterday, 10 days before yesterday.
Uti mo nga alo tayo patsanik ulo e hulit. Tayo mo nga tayo chumani.
Given your response to one of Emma's questions, are we expecting more fluctuations in the case numbers still?
Kaya kaya mapidyo tigil lugo tayo ko asid jok takata lang aba sulikat siyo ningin.
Yes.
Jackie McKay, CBC News. Dr. Patterson, you said you haven't seen any evidence of vaccine failure. Can you explain what vaccine failure would be?
Jake maki CBC kuniluta Patterson o kayo gabi tako naluna sa mangito hamning ani tako kaputi atu hamning itu miniuning ani tukis ila tuking ani ko sa karela.
So the threshold that I'm using, and you'll read, there's at least 2 or 3, I think, floating around for that term, but anyway, the threshold that I keep in mind is acquiring new COVID infection 2 weeks or more after the second dose.
Dan kidlinga naluna taw si mayok sulo nuwa jo naktaong namne mako pinasa ko si nalaw tilugi mako ati kapiyaw si malirlo ni tayo matag tukiling.
Why won't you say if the positive cases have been vaccinated?
Sumahaw nang ila titay ko nuwa jo naktaong tumini kapiyaw si mga ata or not. Or not.
Because it's their information and it doesn't change what we do.
Teko kang unak tu mata teko no asingin no to saktaw ga kang mata.
The Canadian Press. How many people are doing 14 days of isolation outside of Iqaluit right now?
Ama trying to Canadian Press kun ne hatsi wa inu ina daily titaw yulo ni 14 ni haloy sila tani.
For travelers, like for people who are following the general order on travel, we don't and cannot track that.
Tako au lahat daktu no hatsi uning inni nalo na sigun nang tugu nasaktaw hatangin mata.
And the total number of people who've been identified as high-risk contacts due having been in contact with someone who's definitely got COVID-19 is too small to report.
Tako katili malugi nalo na taw si mayod imaulo ka anak tumigo ta katuin na kaham ningi katis si mayo miniuning no hatsi na ulo am ningin no ukakon nang itabo.
Can you tell us the percentage of people in Iqaluit who have been vaccinated?
Ukakon na kay hatsi percenting ya kalum miyo kapiyaw si malang mga ata.
Not right now. Sorry.
Aga. Mamaya na.
Batarna, it's Yak News. Have the cases in Qinghai been sent south for variant testing?
Say that again.
Have the cases in Qinghai been sent south for variant testing?
Tas temperature na siya kung nitay ko aking na kaya sakta meniyo yung kalunano au lak titaw si maba touch manuvad jo na sangin palyaning anong ikalaw mga ata.
Yeah, right now we're sending all positive samples for variant testing.
Ilo na tita magkakaya sa ko tili mga kalunano au lak titaw hatak to ta ko anuvad jo na touch message palyayong ikalaw mga ata.
As those tests start to come back in the coming days, how could those results help your team?
Tako tak palya na lak tilugi kaya sa ko tiyo kano ikayo nang nakailit sino.
Depends on the variant. Some of them are more, some of them transmit or spread easier than others. Some of them are more likely to have severe infection, so it gives us better information and aids our response that way.
Adigi hatag nito itako asidji palya na kaktaw yun no badyo anay ilangi siyang masakay na sa video ang nakaktaw yun ilangi kanim badyo anak naksaw nakaktaw yun tayo magtako to kisige ako ito ikanit siya akong nakayaktaw kano ka magigayak mga atigo upalungayak sa magong nakuluta.
Jackie McKay, CBC News. The doses promised now from the federal government, are you expecting those to be Moderna, or are you looking at other types of COVID vaccines the territory could have?
Jackie McKay, CBC kung nitako kaputi ka ni tunijaw na ang dras sa mayo government o kung ni niriupi Moderna na ang mga tao baluas ting itamang ano na bumutaw na ito.
Right now, we're expecting it to strictly be Moderna.
Niriu gaya to abo Moderna o gayam ningin ni.
My next question is for the Premier. with the recent cargo shortage, is there anything the GN is doing or will do to help alleviate the cargo situation?
Tako amiga sakatalaw ningin no kanga tayo ko tiki hatak to ipilogi no na bugawa makungi kano ilaw na kataman na pilogo.
Thank you. For Iqaluit here, I've been informed that Northern was restocked now, and the marketplace, Arctic Ventures, is restocking their shelves as we speak. So I think the situation has resolved itself. Takwa ertabani Iqaluit ni takwa nakit amiga pekoti amiga yalo mata kaujo himayungaman na takwa New Verwick ilulder miu matay na Arctic Ventures Marketplace man na tayo ilulder padliya takwa nakakaloik pagkatikilautan.
I'm a transfer for the Canadian Press. Mine's for the Premier as well. How is the government of Nunavut supporting those who are doing isolation right now?
Ewa transfer Canadian Press ko ne kano no na bugawa makungi kayo katay kuno ani tayo liga hakti tayo no.
To the best of my knowledge, the Department of Health would be, and the COVID team, response team would be checking upon them and making post calls, making sure that they're isolating and making sure that they don't have any mental health issues or any help for mental health issues that they need. And if there's any other issues, then if we're made aware, then we will do what we can for people isolating. We want to make sure people can isolate and do isolate. Takwa anite diga dinuban no yakak tuman no yok kawi maya kutakwa anya teliti chi kut amatakwa COVID kut pilirayut ikayok taktut hung kaluang mangata ihmaluang yung mangata hiban yung view taktut tidlo takwa ikayok tawang na kutitakwa anite liyut kaluk kinagay ikayok ayak tabutakwa anite ligelit anite itakong kaluang pigutaka nuban na yuaka ihulin na matay kan igloyo iloni.
Next questions for Dr. Patterson, please. Do you plan to send any more nurses to Kingaid at this point, or do you have enough there as it is?
There's
one more nurse going in on Monday, and we'll see if that's enough.
Justin Patterson, NCF News. This question is probably best for Family Services, but I'm going to ask it anyway, and I'll let you guys figure it out who wants to answer it. So the RCMP criminal record checks are suspended, which means people who aren't already listed as a foster home can't take any children. How are children in social services care or certain placements during the lockdown?
Dasam petano na siya kunik inulirik kunutan na periya palaya kalwa kisani palisik ko man natin na sa hataon ng mata perayat tuminim mga takaway sa rutinik takwa lutigo ang wata kay nakatara hatakaway sakta hatara hangata kanulitaman na kamagiyaw na ka.
The criminal record checks are on hold because of the lockdown here in Iqaluit and Kingaid. But we can look into see what if other detachments can look into a criminal record check, and also I believe there's some online options by third parties, but I don't have that information on hand. Takwa peraya kima mga ta kawi hakoti pukat talinuman na tabani Iqaluit ni Kingaid ni ta nukpangan lang mata takwa unalukta ukwa taktaw himang mata kihani takwa nun lali ahani tu pukatali ta kawigak tu lo tu ngata kwa pilera ten tu meng nun lali ahani pilera yu lo mangata matata tant kwa ta tu homa yakut kagan ta tau hima yakut ikya ka vikut ta kwa ayong nangitu de kihani ta na kanun la pi homa nga mana pi himang ita.
Joe Wright, Nunavut News. I have questions for Dr. Patterson. Given how the numbers are staying stable at Kingaid, would you say the infection has been contained, or are we still waiting on follow-up investigations?
Right, Nunavut News kunni tako soko padle lo ni mataking am ni tako sa mapadle gunni sori vigi do balota kivita sule.
It's way too soon to start thinking about it being contained. This is an infection that's got an incubation period of up to 14 days, and we're not 48 hours into since we knew about it, so yeah, it's not contained.
Kila miulo tu taman na house rigi ang atay ma sa mapadle gunni am nakaklugo taman na nubadjong na tay ma timi migun nang haulo ni 14 nik sa mapadle gunnak tu nilo. Ikakay 48 na langin matalon ni tay makakaon nang imakitu.
Just to correct what I said, it's too early to say that it's contained or even comment on it.
I already said that. Kila miulo tu taman na sa mapadle gunni ang nakatawlon.
What variants are there within Canada that people should be aware of or, I guess, pay attention to?
Kisu bata ko sa Japan yun no badyo anak to itamani ka na tamilok to kayo magyaligo.
Well, there's a number of variants that have there's reasons to be concerned about. Some of them, some vaccines may be less effective, some transmit easier, and some cause are more likely to cause more serious infections. Yeah, there's a number of variants of concern. And then there's a number of others that are mutations that don't really matter. Probably the most concerning one right now is P1, but there's a very small number of cases of that one.
Tako ajiging ito isumalo tawgali asiji palya yun no badyo anak to it. Tako ilangit kaputi mo ila sangilo ang atato te kakayang ito tamakwa kaputi ilangin nun. Ilang isama sa narsay, ilang hanim marjuan ng narsay. Ilang tako ajiging ito asiji palya yun isumalo ng ito galwa kasi anita na piwan ng nakaktayo asiji palya yun na isumalo ng nakpangayo. Kasi nakatsin na yun.
And to be clear, there's no record of that one being in Nunavut, and the reason for concern is there's not enough information on how well the vaccine works to protect us from it.
Tu kasi nakaktil lago tako tay may tu sulino na bumuti kasi mangitut amalo mana yu tu kasi na to halo ang makawi sa ko tinita ko kaputi kano ato ti kan laki gayang mga tatako no asiji palyayo.
Jackie McKay, CBC News. Can you say if the vaccine clinics went ahead for inmates and if they've received first and second doses?
Jackie McKay, CBC kunita ko kapiyaw si mayo sivula pa me dugliani lo kapiyaw si mayo hatsi mga tao kakunake.
Inmates and staff in correctional facilities were among the highest priority groups across the territory. And staff and inmates were offered vaccinations even in Iqaluit several months ago.
Tako tigo yan si mayo amalo kanayap tingi sibula pa jaw ga kala nga tatamani no na bumi. Tako kanayap tingi tigo yaw si mayo lo ikalon ni kapiyaw lo to takira sa ina si mamakilak to sibula pa nga katawlaw mata.